Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We are located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. In this week's edition of the Chiropractic Corner, we're going to discuss a decades-old technology that's making its way into the healthcare field called magnetic resonance therapy. Steve Frischman, Director of Magnecuetical Health, is joining us this week via telephone from St. Petersburg, Florida, to talk to us about MRT, or magnetic resonance therapy, and answer some of the questions you've been asking. Welcome to the show, Steve. We're happy you could take time out of your crazy schedule to join us today.
Well, thank you very much for having me, guys. It's a pleasure.
It's good to see you and talk to you, Steve. We really appreciate, like we said, you being on our show. And I think the first question we'd like to ask you then, just to get started, is what exactly is magnetic resonance therapy?
Well, you know, guys, much like magnetic resonance imaging, or MRI, which we're very used to, magnetic resonance therapy, or in this case the Magnecuetical, works exactly the same way in that it goes after the same types of molecular targets in the body, but instead of being exposed to very high magnetic fields in order to produce an image, magnetic resonance therapy, particularly with the Magnosphere, resonates at a super low magnetic frequency or field, 50 million times less than a cell phone, to actually provide therapy to the molecular targets that we're going after.
Steve, can you explain to us what the mechanism of operation is? What exactly is taking place in the body so our listeners can get a good idea of what's going on here?
Absolutely. And you know what? What's very important here, and before I even answer that question, is the fact that this is not just some hypothesis or some theory that we have. As of late, the University of Oklahoma, their Heart Rhythm Institute, these are the guys that invented the ablation technique for atrial fibrillation. They actually published this in their latest study, and what's actually going on is our super low magnetic fields stimulate the whole autonomic response in the brain, and we are actually engaging or stimulating the vagus nerves. Now, the vagus nerves run down the brain, down the side of the neck, to all of the major organs in the body. Everything that works automatically, whether it's the heart, the lungs, the digestive system, etc., and the skin.
Now that's an example. You're right. That's a major cranial nerve.
The vagus nerve is sending neurotransmitters throughout the whole body and the skin that are actually in a hyperparasympathetic tone. And when I say hyperparasympathetic, we have the sympathetic nervous system and we have the parasympathetic nervous system.
Okay.
This is the kind of stuff we learned in biology class,
right,
or an anatomy class in high school, where someone's either in a fight or flight mode, which is sympathetic, or rest and digest, parasympathetic. And that's where healing takes place, in that parasympathetic state.
Right.
So what we're able to do is put a person in this hyper sense of rest and relaxation, except they're not in deep sleep. They're awake. And the body just does what the body wants to do, and that's heal.
Okay. So the magnetic resonance therapy that we utilize then is what relaxes the body, stimulates that specific part of the nervous system, which then allows the body to heal.
Correct. All we're doing, and really all that's taking place, is we're addressing vibration, and molecules are just tiny magnets. When someone is experiencing pain, stiffness, inflammation, sleep issues, behavioral issues, whether it's autism or post-traumatic stress disorder, the molecules of the tissue involved in that particular illness or disease state, if we want to call it that, excuse me, are out of resonation. The vibration is not in tune, if you will.
Okay.
You can get down to very simple layman's terms.
Okay.
They're vibrating erratically. What we're doing is steadying that incorrect vibration of those molecules so that the body can just do what it wants to do, and that's heal.
Okay. Well, now that we've kind of established a little bit about what the mechanism of operation is, how about the different types of protocols or conditions that this addresses? What do you have different field strengths then for these different conditions that the body can heal?
Oh, another fantastic question, because that's one that we're asked a lot. And the truth is, we have over 100 standard protocols after 30 years, by the way, of this being invented. And after all that time, what we've been able to whittle down to is that specific illnesses or conditions require different frequencies with, over a specific length of time.
Okay.
So, as an example, a shoulder dislocation may involve a ligament molecule, may involve bone, nerve, muscle. So we have to change the vibration. We change those frequencies within a 1-hour protocol, let's say. So someone may have 6 different frequencies within a 1-hour span.
So what makes the device, Steve, different from magnets in, say bracelets, necklaces, the mattresses we've seen, things of that nature? Why is this different?
Well, here's the major difference. Most of these devices, most of these PMF devices, these simple coils that wrap around a body part, or these mats that you lie down on, or especially static magnets, regular magnets, they only have one frequency. Some of these other products, they do have a number of frequencies, but the effect is very localized. It's only on the area that they are applied to. Whereas what we're doing is whole body magnetic fields in a uniform structure. The field strength is always the same, and it embodies the whole organism. Okay? And because we're doing that, we are always affecting the brain and that vagus nerve. We're encapsulating that area. And that is the most important part of the body to affect, because the brain controls everything.
All right.
So if you have something that is only on your shoulder or only on your elbow, you're just going to affect those areas. And you don't always know if you're in the right frequency. That's the thing. Many products out there have a range, and a lot of times that range is a bit too high. Does it work? Yes, it does. Does it necessarily work as fast as it could have, or do the positive effects last as long as they should have? And the answer is no. And everything I'm saying here is it really has to do with research, peer-reviewed, double-blind, randomized, placebo-controlled research. And whenever you're looking at any type of medical solution, or if you want to look at any type of resolution to an illness, you really have to look at how much research has been done in order for them to come to any conclusion. The good news is we've got 30 years of that.
Can you give us some specific instances of research that have been done here in support of magnetic resonance therapy? Since I'm kind of on the inside, I know you've been dealing with trying to get it resolved for Parkinson's. I know there's been some neurological research being done. I think there's some research being done on heart rate monitoring, etc. So could you just give us some examples of some of that research?
Well, I think some of the most compelling research, and I said at the beginning of the show, is what's being done by the Heart Rhythm Institute at the University of Oklahoma. They have been doing research since 2003 with our device, and they've published 3 times. This last time, which was in April, didn't just state what we knew is already a conclusion, which is, hey, if you have atrial fibrillation and without the use of drugs, sitting in our super low level, picotesla level magnetic fields of the magnetosphere, we could reverse that atrial fibrillation.
Wow.
But here's the important part here, and this is for many different, and this is exactly what we were told. Now we understand Magnecuetical Health, why you do so many things so well with the Magnosphere. It's because of the way we stimulate that vagus nerve that is essentially that director of traffic of neurotransmitters from the brain to the rest of the body. And that's basically it. It's math.
Well, and who doesn't love math? All right, Mr. Steve, another question we have for you that we hear every once in a while in our office or see in people's eyes is, why should I try this? What is this technology going to do for me?
Well, here's why you need it. First of all, if you have any sort of problem, if there is any sort of pain that you have, regardless of the reason why, and I'll use the word indication. An indication can be a disease, it can be a sickness and whatnot. Mm-hmm. It could be blunt trauma, it could be a recent car injury, it could be whatever ails you.
Right.
If you are experiencing pain, or you have inflammation, or if you have stiffness, or you have sleep issues, or you even have depression or anxiety, and nothing has worked, and you really don't want to go the route of drugs, which seems to be, the modus operandi for the medical industry today, and you just want something that's natural and that's proven to work, that is why you at least want to give this a try. Because the worst thing you're going to experience is sleep. That is our one side effect. Regardless of whatever protocol you're treated in, it could be for a broken bone, it can be for autism, it can be for neuropathy, it can be for a simple lower back pain. The side effect, the only side effect we put out is better sleep, because we're always working on that autonomic nervous system in your brain, and we relax you. Relaxation against stress is the key to not getting sick.
Right.
That's why we have proven throughout science over the course of the last 20 years. The old expression, stress will kill you, well, they really meant it, because it does have a profound effect on the human body and tissue within the human body.
Yeah, it really does. And that would explain why so many people, particularly men, not to pick on you or point you out, fall asleep during that hour therapy. It's like a fabulous power nap for them.
Well, and you said it right there. And what a lot of people have trouble doing is sleeping. And sleeping is when we heal.
Exactly.
Sleeping is when the body gets to, rejuvenate, when it gets to rebalance and realign itself. The bottom line is, how do you get someone to sleep naturally without taking pills? How do we get them to be able to have solid sleep? How do we get them to be able to wake up with energy and invigorated? And relaxation is the key. You can say you go to sleep and say, I was asleep for 8 hours, but if you woke up 5 or 6, 7 times during those hours of you being in bed, well, that is very, very interrupted sleep, and in fact, not good for you. And you never get into that deep, deep, profound sleep that you need to get into that hyper-parasympathetic state.
That's when, like you said before, that's when the healing occurs. And it's interesting,
Correct.
As a side note here, people, talk about, why do I sweat when I sleep? One of the reasons people sweat while they sleep is because, interestingly enough, their body is working hard trying to heal whatever's ailing them. And one of the consequences of that can very well be a mild amount of sweat. I'm not talking about profuse sweating, but it is not uncommon that you might sweat a little bit at night because your body does work hard trying to heal. And I also found it interesting, your other comment about the pharmaceuticals, which, that plays right into the hand of a chiropractic physician, that, we are a drugless science and art. And we are always trying to find ways to help our patients deal with pain, especially chronic pain, without the use of pharmaceuticals. So that's the Magnosphere really fits into that for us very well. And
well, the Magnosphere has been used on professional football players, hockey players, Olympians, celebrities, sports celebrities, that is. That have had either chronic pain or acute pain from a recent injury, and I'm even speaking of things like torn ligaments in the ankle.
Right.
Heck, if anyone's ever experienced a torn ligament in the ankle, they know how painful that is. And we've taken people who have done that, who after only 1 or 2 sessions have been able to stand up on that injured foot and not experience pain.
That's an amazing story. With another question we get very commonly in our office, and then from people when we talk to them about this technology, is how safe is it? Now, you did address that here a few minutes ago, but I think it bears repeating so that people can really hear it, that this technology is relatively safe. That's correct, right?
Oh my gosh, yes. I mean, listen, we're going to give a very quick math lesson here. The unit of measurement for magnetic fields is Gauss, Gauss.
Okay.
The Earth's natural magnetic field that we walk around in every single day is half a Gauss. The magnosphere resonates at 10 to the minus 12th Gauss. It is super low, and that unit of measurement is called picotesla. We're super, super low. We're 1 trillion times less in magnetic field strength than an MRI.
Did you
and
say
we're 50
trillion?
million times less than a cell phone. So if it's up to use a cell phone or stand in front of a computer screen, you got to know it's super, super safe to use the magnosphere. So we are FDA cleared as a low risk, no risk class 1 medical device. So it can't get safer than that from that standpoint.
Right, and you said trillion with a T.
Yes, with a T, we are 1 trillion times less in signal strength than an MRI.
Okay.
Well, address some of the exclusions, if you would, at this time. What type of patient maybe should not step into the magnosphere, as far as we know right now, anyway.
We basically talk about 4 types of conditions that are what we call contraindications.
Right.
However, what's very important to note is that these are not clinically proven contraindications whatsoever, but they're more for just us being safe and not running into any sort of legal problems, because unfortunately in the United States, people have the habit of wanting to sue anybody for anything.
That's right.
So just to make sure we keep our doctors safe and keep people honest, we tell people that whoever has an implanted brain stimulator, for example, should not get into the device, only because implanted brain stimulators resonate at a super low frequency, and we just don't want to take the chance of interfering with those signals. The other one is anyone who is suffering from epilepsy. Let's say a person has, on average, 9, 12 random seizures a month. We don't want anyone getting into our device, whereas the doctor hasn't even started the treatment yet, and because they're super nervous or scared or what have you, they decide to have one of their random seizures and blame the doctor and the device for one of those seizures.
Right.
And I guess the other two are people that have poorly controlled severe heart conditions or poorly controlled high blood pressure. And what I mean by poorly controlled is they're really not seeing a doctor whatsoever for care.
Right.
And they're basically saying, whatever comes, I'm just going to wing it. I'm just going to, self-medicate, or, let the chips fall where they may.
Okay.
So those types of people, we just don't want to take a chance. And it's funny. The ironic thing is we have all sorts of clinical evidence and peer-reviewed research that we help people that have arrhythmias.
Right.
So it just stands to reason we're just trying to protect our doctors.
I understand.
The ironic thing again is that when it comes to things like people that suffer from seizures, many children who suffer from autism, one of the things that they present, besides gastrointestinal issues as an example, are seizures. And we actually help autistic kids who have seizures, and they end up having less seizures. So it's kind of ironic, but there are certain things we have to go by, and that's just one of them. But we don't have any clinically proven contraindications to the magnosphere.
Okay.
Well, that's good to know. All right. Well, Steve, why haven't we ever heard of the magnosphere before? Why isn't it just out there everywhere? Well,
you know what? I guess it's akin to the internet that was basically came out in the late 1960s, via the U.S. military, and that was their mode of communicating with each other in secret, or the cell phone that actually could have been out 15 years later. 15 years earlier than it actually was, or video phones. Everyone's doing video conferencing now, but you take a company like, Northern Telecom. Northern Telecom actually invented the video phone that you could have used in your home in the early 1970s, and it actually never really came to bear. It's just everything has its place and its time. we're not a very big company. We're a small company, although we have installations across the United States and Canada, and now a few overseas. Our time wasn't then. Our time is now. Because the public, the patients, the doctors, they want to get away from all of the drugs. They want to get away from all of the side effects. And they're looking for something that has proven to work. And that's what it has at least left the general public with a more open mind. And because they have a more open mind and more willing to try alternative therapies, they've essentially have not just given the Magnosphere a chance, they've actually adopted it and are now seeking it. So the word is really starting to get out now.
Okay, Steve, one quick question. We're getting close to running out of time here. I think we're getting close to the end, but how would the patient know, other than the doctor telling them so maybe, but how does the patient know that it's working for them?
Well, you know what? If you have pain, if you have lumbar disc herniation with neuropathy or a cervical issue, or if you've been diagnosed with fibromyalgia and you've been living for 5 or 10 years with severe pain, and you sit in this thing, and for the first time in 10 years you get out and your pain has diminished 90%, that's a great way of knowing. That's a great way of knowing. I mean, but let's just say that's anecdotal. Let's just say there's placebo effect there. We've had many, many cases where people have gone in with lymphedema and the size of their calf between their knee and their ankle is the exact same size because of the swelling. And there have been pre-measurements, with a tape measure and post-treatment measurements taken with the same tape measure. And there's a 65% diminishment in the size of that calf, just going to prove that the Magnosphere does reduce inflammation, except we do it at the cellular level, so you actually see the results quite quickly.
Okay, one last topic I'd like to get onto here in the last couple of minutes is the Halo unit. Everything we've talked about up to now has primarily been within a doctor's office. Like, we have the Magnosphere at our office, and a lot of the things that you've discussed are things that we discuss with our patients and try to explain with our patients in the office. But there is a unit that the patient who has a condition that requires ongoing care for the quality of life they'd like to have, that they could actually do this in their home. Why don't you take a couple of minutes to talk about that?
Well, we invented something just over a year ago called the Halo, and it stands for Home and Lifetime Option. So you have people that have acute injuries and they go and see the doctor, or recurring injuries. Let's say they're a basketball player or a golfer, and they're relatively okay, but their back goes out once in a while, or their knees are really sore, shoulders, neck, what have you, and they're not going to stop playing golf. And they go into a doctor's office and use the Magnosphere, and they discover the best frequencies that work really, really well on that patient. And the patient's paying a certain amount of money at the doctor's office. Now, they've established this is the frequency that works on the patient. So the patient, no offense, Dr. Volstad, but I mean, if anyone ever had a choice, they would never have to go to a doctor. They just like to be healthy and happy all the time and be on the golf course all day long.
Yeah, right.
What this gives the patient is the ability to treat themselves every day at home,
right,
the convenience of their own home, at a mere fraction of the price, and with using the exact same efficacy as they were getting in the clinical unit at the doctor's office. Now, very importantly, though, for more chronic and diseased states, whether it's Parkinson's, MS, rheumatoid arthritis, Alzheimer's, post-traumatic stress disorder, people that have other sorts of chronic conditions, just like, you have to eat salad every other day and exercise in order to maintain good health and weight, you want to do this as much as possible to maintain this newly found health of yours and to keep it going. So people want to treat themselves at home because it's convenient, it's affordable, and it's effective because it works.
That's right.
And that's why people want to use the Halo device.
Having the Magnosphere in our office, we can certainly attest to the fact that this is a technology that works, and our patients are better off because of it. Steve, we'd like to thank you for joining our show this week. We really appreciate, once again, you taking time out of your busy schedule to join us and to give our listeners and friends an insight into magnetic resonance therapy. And who knows, maybe sometime in the future we can bring you back and maybe talk a little bit more about some of the research that's ongoing and maybe kind of catch up and get an update on magnetic resonance therapy and Magnecuetical health. But we thank you very much for joining us on the program this week.
Well, thank you for having me, and it's been an absolute pleasure.
I'd like to once again say thank you to Steve Frischman of Magnecuetical Health for being on our program this week. If you're interested in trying the Magnosphere, we offer a complimentary session at Volstad Chiropractic and Integrated Wellness. Our phone number is 746-4242.
Well, that about wraps it up for another edition of the Chiropractic Corner. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, at gmail.com. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about health care and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner right here on WJUP, The Jupe, 103.9 FM, Friday morning at 9 a.m. right after the Dick Farrell live show, and again Saturday right after the 10 a.m. news. Until then, be well, live well. We'll see you next week.